it's Anya here again. So today's video school is to give a latest update on my health. Mostly my recent doctor's appointment. So today is Saturday. I went to see a doctor Thursday, so a few days ago. Right. So a few days ago on Thursday, I had a doctor's appointment, and every time I have doctor's appointment, I have to first go and give blood. Then I see doctor, and then I usually get some sort of shot. And at the moment, I'm seeing a doctor once a month. Right. So this Thursday, I first started. Of course, I got my my blood work done. One thing, I think I never have mentioned it, but giving blood is really difficult for me because me and like a lot of other people happen to have very thin veins, which means that sometimes the person who's taking the blood, if they are not super professional about what they're doing, they're going to end up using me as a pincushion. It varies. It has been worse, it has been better. It has been many times when first person tries several times, asks the second person to come, like either to take blood from my vein or put IV into my vein, and then usually after the second person tries, they ask the third person to come, and then the third person usually is like an expert, they go and wait for somebody who they know will definitely be able to do it. This makes all this blood work, IV work, all this stuff for me very uncomfortable. I'm already the type of person who is kind of not comfortable with blood. I have fainted several times when I have seen blood. So all this stuff is very difficult for me. This Thursday, it wasn't too bad. Unfortunately, it was a new nurse. So if it's a nurse who already knows me, usually gets the blood done with the first, it just puts a needle in, gets the blood out, we're done. Unfortunately, this nurse hadn't taken blood from me before, and so she had to do two tries. First, she tried to do it here. It was very painful, she couldn't do it, she just tried, and then she gave up and took it from here. And then it was good. One thing I usually try to do when I give blood is I try to get my blood pressure up a little bit. So normally I have normal blood pressure or even slightly low blood pressure. And what has happened is that even when they get the needle in, the blood doesn't come out, or it comes very slowly. So what I try to do is try to drink coffee or something like that in the morning or before. And also another thing is I try to be very hydrated, get a lot of water into my body. And so both of those tricks usually help a little bit with having things done a little bit more smoothly. But yeah, overall, I'm not a fan of any kind of needle stuff. Then I went to see my doctor, and so it wasn't. So right now, everything has been very stable, right? So I get scans done every 3 months, and my next set of scans, I'm going to get an MRI where they put me. They're going to sedate me, because I cannot do MRI consciously. So I'm going to have an MRI done next month, that is March. Right now it's February. And then I'm also going to get PET-CT done, right? That should give a full body work, a very detailed work, and show the cancer everywhere, wherever it's hiding, right? And so right now, as things are just stable, there isn't a lot of things to discuss with the doctor. I just usually in these situations I just give overview of what has been happening within the last month, like the pains, aches, new pains, things like that. So for example, what I noticed was then when I started getting the EPO shots, the biotin alpha shots, I started getting pain in the middle of my back. So the spine, right in the middle, it was completely a new spot. And the pain hadn't been there before. And then every time I get a new shot, so I ended up getting 4 shots total. Every time the pain went worse and worse, and it was actually the absolute worst in the middle of the night. It was so bad that I would wake up every night around 4:30 a.m. and I wouldn't be able to move. Like I would be lying there, wake up, and then be in a lot of pain, and then I would try to like turn out or get out of the bed. I was not able to do it because it's so painful to just move, and then I would just okay, get yourself together, just push through the pain, and then I would push through the pain, get out of the bed, to use restroom, I think, something like that. But what happened after my last chemo, so okay, I'm going to do a little side note here, is that I'm not going to say everything again and again in each video. So if you want to know more details, what has happened before, what are the EPO shots, or what kind of treatment I have, what kind of cancer, so I have breast cancer in my bones, all those details, if you want to know them, I'm going to put links underneath my this video, and so you can go through and look at them up. So this is my health update 005, so it means there are going to be at least 4 updates of my terminal cancer review of what my health has been. Right, so getting back, so I'm getting chemo, so I orally at the moment. I take chemo medication as pills. I take three pills in the morning and 3 in the evening, 7 days in a row, and then 7 days I don't take it. Right, and so it's like every week I would take a chemo. It would call the chemo cycle, right? Right now I'm again in my chemo cycle. It's my 3rd day. So the last chemo cycle, even though it was very hard physically, mentally to go through the chemo, the pain that I described that was in the middle of my back actually disappeared. So I don't know if it was cancer, I don't know what it was, but chemo somehow managed to get rid of that pain, and now I don't have it anymore. Like in the middle of the night, I don't have that pain anymore. One thing I'm worried about is that I'm starting to get night sweats again. So night sweats are so bad that in the middle of the night I wake up, I'm freezing because all my clothes are completely wet, and I have to basically change my PJs to just so that they're completely soaked. It's like I have taken a shower with my PJs on. It's that bad, right? And I have to change the clothes then. So I don't like them. They're very uncomfortable, but also it's kind of a sign that my body is not doing very well. So I don't like that, right? So this kind of information I give to my doctor, like what has been happening, for example. Another thing that we discussed, something that I haven't really asked before from my doctor, is could we do genome testing to my cancer to look mutations. So because all the time more science comes up, medical science comes up with a specific targeted treatment to cancers that have very specific mutations, or also immunotherapy and things like that. And even something like that could happen, that your cancer mutates. Like for example, you start with a breast cancer that is like triple negative, and it can mutate, be like estrogen progesterone positive, HER negative, or things like that. It can just kind of mutate and flip. Right now, I have, and I always have had, as far as I know, whenever they have done the testing, my cancer has been positive, estrogen and progesterone positive, and HER negative. Right. As I mentioned, the cancer is metastatic. It's breast cancer that has gone to my bones. Unfortunately, I do not have only one site. It's kind of in very many areas. It's in my spine, it's in my hips, it's in my skull, and right during the chemo, when I have the chemo cycle, I'm mentally and physically kind of, I feel like I have been run over by a truck or something. I have a lot of pain, bone pain, general tiredness. Overall, I just don't feel good at all. My memory is bad. Overall, I'm not as capable as normally during the week when I don't take the chemo. Right. So whenever I'm making a video and you notice that I'm kind of more down, or maybe sometimes even my face shows more tiredness, you can be sure that it's the week I'm having the chemo cycle. Right. Oh, getting back, I started talking about the genome testing, right? So what my doctor said is that it's absolutely not necessary yet, which is very good news actually, because the idea is that I don't need it yet. All the drugs that are all there in general that should work, there's a bunch of list, like a list of medications that I can take before I have to even worry about having the list run out of the medications that I can use to fight my cancer, right? And once that happens, then we start doing the genome testing, and we starting seeing, do we have mutations? Do we have is there any kind of specific drug available? Is there a trial available? So this is something that you would do more at the end, right, of the journey, so to speak. Right, because I have been having this, so I have been diagnosed with terminal breast cancer now about a year almost, and the first medication that we tried didn't work really. The cancer, so that the scans showed that the cancer had grown, so we changed to the current medication, and the scans this far have shown that the cancer has stopped growing. Right, things are just stable, and as long as things are stable, you don't have to really worry about things, right? You just kind of keep living with how things are. Only problem is that the longer I take the chemo medication, the more toxic it is towards my body. It's kind of like builds up, the toxicity builds up, and that's why I feel more and more worse whenever I have to take the chemo, right? So originally, when I started taking this specific chemo medication, I would feel like nausea and very tired, like a 6th day, 7th day, right? Last 2 days of the cycle. And now I actually feel the very first day. So for example, on Thursday, when it was my first day of the chemo, I was okay until about 3 p.m. and then it's almost like my feet went underneath me. I still had to do things. I still had to go pick up my daughter. I had to go take stuff like my hobbies, suits to chemical cleaners. I had to take my daughter out for food because I was like, okay, I am not cooking here. So I took her to Panera Bread, but I was just barely moving, barely. I was like, I'm going to just fall over. That's how I felt. And so just barely managed to get through those things. And I still had a few things on my list that I had hoped to get done, the errands, but that was it. We got home. My daughter started, I think she started playing with Legos, and I just fell to my bed and I fall asleep. Luckily, my hubby came home soon after, so that my daughter kept playing and my hubby came soon, because basically I was knocked out. I wasn't able to keep an eye on my daughter, and that's just not good, right? I wasn't able to play with her. Sometimes we do like I work with her with extra math. It's like we try to read, we do stuff, and yeah, like chemo days. So I notice like half a day I'm pretty okay, and then I fall. I'm done. And the third thing really that we discussed with my doctor was that I kind of complained that I had very suddenly gained a lot of weight in a very short period of time, within just maybe 3 months or something like that, or even it was like almost overnight. I gained like 15 pounds or something like that, and and I had thought that maybe because I had been depressed and because I had very severe anemia, I had been staying in bed a lot, I had been not moving much, so maybe I was just, even though I wasn't really eating almost at all, maybe I still managed to not, spend that energy, and so maybe that's why I gained it. But what my doctor said that most likely actually what it was is Ritalin. So at some point after my diagnosis, I would say about 4 months after my diagnosis, I started feeling very, very depressed. Like I had been taking general antidepressants already before, and I don't think they really worked. I was just staying in bed, I wasn't really doing anything. And so my doctor was, okay, we need to get you out of bed. Yes, you have anemia, but you should actually be still moving a little bit more than you are. And so she prescribed me Ritalin. Ritalin is basically like a small dose of amphetamine. And so I kind of thought that I'm going to lose weight, that Ritalin should actually help you lose weight, right? Look at the drug addicts, they're usually very skinny. But what my doctor said that no, the way Ritalin works is that it gives you really like a boost of energy. It really does. It kind of wakes you up. You don't want to stay in bed. You want to get out. You want to do things. It really does work like that. It has really helped me tremendously. I mean, above and beyond. I really need still Ritalin. Yes, I'm a little bit fat, or I don't want to be saying fat shaming here anybody. I'm just, I have always been the same weight, always, and suddenly my weight just kind of went up like overnight, and so I just felt really like uncomfortable, weird about it, and I made a decision that is okay. I need that energy. I need to get out. I can take care of my daughter. I can do work. I can clean the house, and it has been like slowly every day has been better. Like I have been able to come out of the depression, right? And I still notice that I'm still getting better, that I was really like almost not doing anything at all, right? So that was the third thing we discussed with my doctor. And then after seeing my doctor, I had a shot. So once a month I get a shot that is for strengthening my bones, right? As I mentioned, the cancer is in my bones, it's all over the place, and it's the same medication that women who are in menopause are prescribed, right? So there's nothing very specific about it. Only thing you have to be careful about is that if you have a very severe turnover coming up, you have to stop taking it for a while, like a month before, a month after. You shouldn't get those shots. So just women watching my video, if you are getting one of those shots, then maybe your doctor forgot to mention it. So right, so yeah, like if you have crown work or root canal, you need to pull out the tooth, so it can have many severe complications. Right. I think overall I covered everything I wanted to cover from my recent doctor's appointment. Right. One thing I wanted to mention is that, or actually kind of it's a question to the viewers, that I make different types of videos. One are like health updates that are very specifically just about my health, and then there are videos where I do stuff with my daughter, right? And right, so I wanted to ask, what kind of videos do you really prefer? Now, I won't stop doing specific videos, but I might change like the ratio. Right now it's more like 50-50, but I might change it to 75-25% or something like that. Also, other topics, maybe you want to see like my house or something like that. What other stuff I might be doing, maybe you're interested in that. Somebody mentioned that they're interested in seeing my beak, so I'm really thinking about making a little movie or maybe even two about my beak, because really I have a beak, and really my beak is emotional support animal. I got my beak right after I was diagnosed. I have always wanted to have a beak, but I always thought that, well, I'm not going to get the beak until I'm like retired, and my hubby really doesn't want the beak and things like that. But then when I was diagnosed, I was thinking, well, it's kind of like a bucket list thing. If I want to have a pig, I have to have her now. And right, and they live like 15-20 years, and that's also something that I'm like, okay, I have to last 15-20 years, because I have to need to take care not just my daughter but also the pig, right? But yes, she really is emotional support animal. Like whenever I feed her, whenever I take care of her, pat her, scratch her, anything related to my pig, it really, I feel good in my head, right? Some people have dogs, some people have cats. Even the chemo center that I go to get my shots, they have actually sometimes emotional support animals come in. Like for example, dogs come in and they just let the dogs sit on top of you, because research has shown that it really helps you mentally. It's very good for you, right? And one more thing I wanted to do, while I talk a little bit at the end of my video, I want to put on a little bit of more makeup. So I did my base, I did my primer, my foundation, and let me just do my eyes, my eyebrows, my lips, and my cheeks for things. Okay. So one thing I'm really thinking and kind of struggling about is things that I can talk about here. I would like to talk about maybe more about my relationship with my hobby, but at the same time I haven't really, because there's really a lot to say, and I think it would really help a lot of women who are in my situation to understand their husbands better, or men better. I mean, there are men who are very, very, very supportive and things like that, but majority of men, they're just not naturally nurturing, and they just don't know how to help you, right? And so I don't know, I really want to give I want to really make a video about our relationship, but at the same time I'm scared of insulting or maybe saying something that my hubby wouldn't like. He does know that I have this channel. I don't think he actually bothers going through and watching the videos, but still, maybe I say something that he doesn't like. I don't know, is it worth really risking having a row with my hobby just because I could do a video? No. Anyway, so if you have something, what you think, please comment. So if you really think and say to me that, hey, I really want to know how things are affected in your relationship when you get sick with cancer, or you're just severely sick, how relationships change and how to deal with it, because I have learned a lot, right? Because I was first diagnosed like 6 years ago, and then, right, originally it was very, very difficult. My hobby was just horrible, and I didn't know how to voice what I need, and overall he made the whole thing 10 times worse. Like, it wasn't that he just didn't know how to even support me or anything, he just made it 10 times worse to go through everything. But since then, right, I have seen a therapist. We even did a little bit of counseling, and so now after I have been diagnosed, he has learned things and he's better, and also I learned things. I know that, one thing is very important to always remember: you cannot ask somebody to provide you something that they cannot give you, right? They might not be able to say the words that you need to hear, so you need a different person for that specific task, right? I think a long time ago I read that you need about 7 people around you to really have all your needs met, right? So maybe you have one person, like one friend, you talk about something, and another friend, you talk about something else, and etc, etc, and so eventually, right, you get all your needs met, whatever you need to talk about with different people, because men tend to be different. I'm sorry, I mean, you can say what you want, but at least my hobby, he doesn't show love the way I showed love to him. He doesn't say things to me. He's very quiet, right? He doesn't say I love you. He doesn't hug me and say everything's going to be alright. He will do it if I ask him, right? But I cannot get mad at it, because he's just not born. He just doesn't know that this is something I need and this is something he should give, right? For example, I talk to my parents almost every day. I get a lot of my social needs met like that, right? I have very great friends that I talk to. I get a lot of needs taken care of like that. And I also, another thing I think in a relationship to remember is that it's kind of like a mirror. Whatever you mirror to the other person, they mirror it back. So if you are screaming at them, you can be sure they're going to scream back at you for right, or they will be mad at you back, right? So you should kind of keep that in mind. Whenever I have fallout, the best method I use, like fallout from the eyeshadow, I find this is the easiest, fastest way. Of course, if you have a eyeshadow that has an enormous amount of fallout, then maybe that's not enough. But usually, if you have an excellent eyeshadow, just a little bit of fallout, this works best. Right. Let me do my mascara. I think this is, what is that? MAC Volumizer Mascara. Torture. So this is definitely something I have gotten from one from my beauty boxes. I'm going to put a little bit of eyeshadow on my lower eyelash line. I'm going to use I'm going to use this color. It's from Lancome eyeshadow palette. And I'm going to use this Kevin Aquan brush with very small tip, very precise tip. I have possibility through my palliative care to use cannabis oil. However, this far I haven't really bothered because cannabis oil has kind of controversial theme because some people say it doesn't work, some people say it works very well. Even the palliative care doctor herself said that it depends completely on the person. So what I'm thinking I should get it, just try it out, but also it's going to take a while before I'm going to be able to get my hands on it. So if you know somebody, maybe you have used, or maybe somebody you know has used cannabis oil, maybe your friends, maybe your relatives, any kind of information you have, I would really appreciate it if you would share it with me. Just leave a comment, say, you know, I tried it, didn't work, or my mom tried it, it was a lifesaver. She could lower her pain medications or nausea medications or sleep medications, you know, something like that. It would really help me. So I'm thinking I'm going to try it, but you know, if I get a lot of feedback saying that it's completely useless, then, you know, I'm going to save my money, because it's going to cost, like, I think the card, first you have to get like a card that will allow you to order it, right, legally to order it. So you cannot buy it in a state I'm living in Atlanta, Georgia, and here cannabis and cannabis oil is not allowed. So first I apply for a card through my palliative care doctor, and then once I get the card, I can order it through online, right? But the whole thing, the card itself is $25, and I think the cannabis oil batch of whatever amount it is like $100 or something. So if you have information, let me know. So very quickly, I'm going to put setting powder. So setting powder is something that sets your makeup. You don't have to use it a lot, but you know, it does help to keep the makeup on. I think one of the biggest troubles with makeup is just to try to keep it on so that you don't have to keep reapplying it. I do have setting sprays that I don't typically use, but I'm going to use it today. I'm just kind of interested to see how it will work. Let me see. I have Urban Decay setting spray. It's a sample size. I guess I got it from one of those beauty boxes. I get majority of my stuff from beauty boxes. But before I put the setting spray, I do the very last thing. I do a little bit of Laura Mercier highlighter with my It brushes from Ulta. It brush from Ulta. That's just a little bit. The other day, my daughter got hands on my highlighter, and she just put it on all over her face. So she was like a disco ball. I can hear my pig crying outside that she would like to get inside. She's kind of very specifically communicates with me. Okay, now last thing. Woo. It just feels like I just sprayed a bunch of chemicals on me. Okay. Thank you for watching. I really appreciate any kind of comment you have. I appreciate all your subscriptions. It makes a world of difference for me. Thank you. Bye.